Hello, my name is Dr. Rosalind Moore. I have a doctorate in physical therapy. My company is Rekinetic Physical Therapy and Wellness. And I started this company because I really wanted to treat women who were looking for something a little bit more than cookie cutter and box treatment for their health and wellness goals. So I treat women who are ready to either start an exercise program or get back to exercise after either an injury or a hiatus. So today I was going to talk a little bit about low back pain. There's a lot of questions about low back pain, and the research shows that probably about 80% of the population has had an experience with low back pain. Research also shows that it can be self-limiting. So that means that you could maybe not even do anything for the problem, and it may go away within 6 months. But I would suggest you work with a health professional and try to get rid of whatever impairments may have actually caused the pain, or work on ergonomics, maybe like your seating at your desk, maybe your lifting mechanics, things like that that may have led to the injury that you're having with your low back. All right. So there are clinical practice guidelines. So these are guidelines that the American Physical Therapy Association has put out in order to kind of delineate what works and what doesn't really work as far as caring for low back pain. And believe it or not, there are really just like top 3 that research has shown that's going to work for you. It doesn't sound like it's the correct information, but it really is. So the first thing is recommending you to just move. So movement, exercise, stretching, foam rolling. The worst thing you could possibly do would be to sit or lie down, extended bed rest if you're having back pain. The second thing is just education, learning what happened and what you can do to proceed. So just actually finding out maybe possible causes, maybe finding out what kind of back pain or what kind of injury that may have occurred, and then just learning about the body process of healing. The third thing is if you have an access to cognitive behavioral therapy. So that's working on your mindset. So mindset either can be working on not focusing on your problem at hand so much and not making it a part of your entire day and a part of your life, and also coping strategies to help you deal with your injury or your pain. So those are really the top 3. There's some other things that could help, and that would be like yoga. So remember, there are different types of yoga. So the yoga that would probably be the best would be like a restorative type of yoga, or one where maybe it's heated and you're doing like standing poses, as opposed to sports yoga or strenuous things where you're doing back bends. Another thing is massage. Now, that's one of those things that's kind of a feel-good remedy, and it can release some muscle knots and some pain, but it usually is a short-term thing. It's not going to actually fix what the problem probably is. Acupuncture and dry needling are another treatment for low back pain. So with acupuncture, usually the acupuncturist will work on the meridians of the chi of the body and just try to find maybe there's some pain points to use those needles. With dry needling, you're actually placing the needles within the tight muscle or the painful muscle to try to alleviate the pain and help increase your motion. There's some other things that people have tried or that are still going on now that it's just proven that it just doesn't really work and don't really work long term. So that would be injections and surgery, really. And something else I just want to bring up is that a lot of people really want to always have an MRI when they have back pain. And in the state of Maryland, you do not need a physician's a referral to see a physical therapist. So I would suggest you always contact a physical therapist first, go through that realm, see if it works, because a physical therapist is going to know if they can't help you or not, or if it's not working, and can refer you then if you need testing. And knowing that you have a herniated disc, I don't know about you, but before I became a physical therapist, I don't know that knowing that I had a herniated disc would actually help me. So it doesn't help the physical therapist really, because we need to find out, do you have tight muscles? Do you have weak muscles? Do you have a leg shorter than the other? Did you have a shoulder injury? And so now, because of your shoulder injury, you're always leaning to one side, and that made your back issues. So those are important things, and it's much more important than having an MRI and finding out what the doctor or orthopedic surgeon says is wrong with your back, okay? So as far as the top 5 exercises that I would say that you should try if you're not having any what we would call red flags. Now the red flags would be something like you've lost bowel or bladder control, or you're having numbness or tingling in like your groin area. Now those kind of things, if you had that with your back pain, you would want to see a doctor, and it'd be a little bit more serious than a strain or a sprain or something like that. The other thing to note is that you can image 100 people, and it has been found that 65 people out of that 100 will have a herniated disc or degenerative disc disease, but they will have no symptoms. So it's not like the imaging really tells you that much sometimes. So as far as exercises, let's get started. The first thing I would say that you need to try to do is probably loosen up the lower back. And so that would be with movement and stretches. And the second thing would be strengthening. So the first exercise I'd have you do would be a single knee to chest. It's just like what it sounds, okay? So lying down on your back, you bring one knee into your chest. Then you would bring the other knee into your chest. And you would want to hold each one of those for 30 seconds and then repeat 3 times on each side. The second stretch I would recommend would be a double knee to chest. So lying again on your back and bringing both knees into your chest and holding. And once again, you can hold 30 seconds and do that 3 times. A lot of times people have really tight hamstrings, and so that means that hamstring is just like pulling on your low back. So another good thing is to stretch your hamstrings. So recommending lying on your back, one leg straight, one leg in the air like this, unless you have a stretch it strap. Try to get your knee as straight as you can. It doesn't matter if it's close to your face or not. It's more important that your knee is straight. Okay. Do one side and then the other. "30 seconds, 3 times on each side. The next is going to be a lower trunk rotation. So on your back again, just rotating your knees over to the right, holding for a few seconds, and then over to the left, holding a few seconds. And you can do that 10 times on each side. So those will help loosen your low back area and your hips. And then you would want to move into some strengthening exercises. So I'll show you 2 of those. The first one that's really important is trying to engage your transverse abdominis. So that is the deep belly muscle. And it comes around here like a barrel. And just think about your belly is the front of your back. So it's important to have that strong. So you want to try to engage your deep belly muscle. And it's in there, if you kind of put your fingers at the top of your hip bones, and if you coughed, you would feel a muscle kind of pop out into your fingers, and that's the muscle that you want to activate. So you can do it sitting, you can do it standing, you can do it lying down on your back. So trying to pull your belly button into your spine, to feel that muscle, holding 10 seconds, and then relaxing. And make sure you're breathing, so if you count out loud, you can usually breathe when you're doing these. So you're pulling your belly button into your spine, drawing that belly button back, holding 10 seconds, and then relax. And you're going to do that 10 repetitions. So sitting or lying down. Okay. So lying down, same thing. I'm pulling my belly button into my spine. So my belly button's coming down to the floor. Really contracting my abs. And then relax. Okay. Another good exercise for strengthening is once you are able to really engage your abs and you feel that, is so you're holding that ab brace and then extending one leg. Back in. Extending the other leg. Back in. So I'm still holding my abs nice and tight, what I call the ab brace. My back is fairly flat on the ground. And I'm going to try to do this for about a minute. All right. So that's a good start. You can also apply ice or heat, whichever you're more comfortable with, for 15 minutes. Usually if it's at the beginning, like when you first hurt yourself, I would recommend ice for 15 minutes. I like ice. So the next thing that you should do is see a physical therapist. So I have telehealth sessions, and I also do mobile services. That means in-home, at the park, at your office, at your senior center, at the pool, anything like that. So once restrictions are lifted, we can look at seeing you in your home or at work. But right now I am seeing clients in the park. All right, so have a great day.